Microencapsulation. Microencapsulation may be defined as the packaging technology of the solids, liquids, or gaseous material within the polymeric coatings. These solid and liquid materials will be packed to form a small particles that's called as microcapsules. The polymer act as a protective film, isolating the core and avoid the effect of inadvertent exposure like environment and biological moisture. To remove the or to avoid the environmental content and moisture, these will be entrapped into the protective film. This membrane dissolves itself through a specific stimuli by releasing the core in ideal place or at ideal time. Microencapsulation has numerous applications in such areas they are pharmaceutical, agriculture, medical and food industries. These microencapsulation is widely used in the oils, colorings, flavorings, sweetenings, and microorganisms, among others. Recently, the food industry has demonstrated increasingly complex formulations, that is, microorganisms in fermented meat and in addition, the polyunsaturated fatty acids are susceptible to the autooxidation of milk and yogurt, ice creams. The use of flavored compounds are highly volatile in instant food, uh, which often can only checked by the microencapsulation. This microencapsulation can serve as effective means of creating foods that are not only a source of nutrients but it contains some taste with sensory appeal but also a source of well-being health and by increasing the level of calcium to prevent the osteoporosis. Using microorganisms produced lactic acid to decrease the cholesterol and to adding phenolic compounds to prevent the heart problems. This is the small and brief introduction about microencapsulation and microparticles, microspheres and microcapsules. These are common constituents of the multi-particulate drug delivery system. The advantages are based on their structural and functional abilities and their applications. The microspheres can characterized as matrix system in which drug is homogeneously dispersed. While it comes to the microcapsules, in this system the matrix will be heterogeneously the heterogeneous particles will be dispersed in this system and the formulation can be incorporated into different pharmaceutical dosage forms like solids, liquids, semi-solids. Here, a major advantage of microcarriers over nanoparticles is that they do not transfer into the interstitium over the size of 100 nanometers. The size of 100 nanometers are transported by the lymph and it acts as locally to possibly toxic substance can be carried encapsulated and liquids can be handled by the form of dried microparticles. In the case of microparticles, the dose distributed in many small separate particles, it carry the liberate part of the dose and malfunction of the individual subunit does not cause any failure of the dosage. This is about the microparticles, microspheres and microcapsules. While we are moving to the advantages and disadvantages of the microencapsulation, here dosage is the choice in this microencapsulation. Okay, the route of drug delivery is choice, and modified and targeted drug delivery. The drug release and drug delivery is modified as a event site specific routes. Okay, and it has more expectable pharmacokinetics with reduced intra subject variability, and these microcapsules are more homogeneously distributed in the physiological environment. The microencapsules are stable or fixed at the dose combinations of the drugs. The microencapsules dose titrations are less dose dumping, and patient certainty through the better compliance and individual therapy, improving stability of medicinal preparations, and isolation of the better compatibility, and to innovate the new products with prolonged life cycles through the protection of patient. This is the main advantages of the microencapsulation. And by the using of these microencapsulation, the drug can be mask unpleasant taste, and to preserve this drug into volatile oils, and to separate the incompatible substances also, to optimize to prolong the drug time can be possible by the use of microencapsulation. The polymer excipient protects the active pharmaceutical ingredient from the environment, that is nothing but oxidation, temperature, pH, or in some cases body from the irritative and mucosal damaging effect of the drug substance. The lesson or example, bisecting of multi-particulate solid dosage forms affects only a small number of units. Thus, it does not result in the change of blood level. However, there are some limitations are there, such as higher product cost due to more expensive excipients. While preparation of the microencapsulations, the excipients are more expensive, so that's why the cost of the microencapsules will be high cost, expensive, and as well as the quality will be good, so that's why it is maintain good quality, and it is high expensively high in rate. And in addition to that, the biocompatibility, biodegradation is also very useful. While we are moving to the process of drug release and microparticles, the process of drug release of microparticles are produced by the special manufacturing techniques, which contains excipients as well as some mechanisms like dissolution, diffusion, osmotic driven release, erosion. Generally, the mechanisms takes place by the side by side, and one or other mechanism provides a great role during the drug release. In microparticles, the active pharmaceutical ingredient is embedded in a